Acute inflammation mechanisms, responses, and regulation. Acute inflammation is a complex physiological response to tissue injury, characterized by localized changes in blood flow, increased vascular permeability, and the recruitment of neutrophils. It serves as a protective mechanism to eliminate pathogens, remove cellular debris, and initiate tissue repa. 1. Stages of acute inflammation. Initiation stage: initiated by tissue injury, which triggers the release of chemical mediators such as histamine, serotonin, prostaglandins, leukotrienes, and cytokines. These mediators induce vasodilation, increase vascular permeability, and attract leukocytes to the site of injury. 1. Stages of acute inflammation. Amplification stage: neutrophils, the first responders, are mobilized to the site of inflammation, migrating through blood vessels and into the injured tissue. They perform phagocytosis, engulfing bacteria and cellular debris. 1. Stages of acute inflammation. Resolution stage: once the invading pathogens are neutralized, the repair process begins. Monocytes migrate to the site, clear remaining debris, and promote tissue regeneration. 2. Changes in blood flow. Vasodilation: due to the action of chemical mediators, blood vessels at the site of inflammation dilate, leading to increased blood flow and redness erythema. 2. Changes in blood flow. Increased vascular permeability: chemical mediators also increase the permeability of capillaries, resulting in leakage of fluid and proteins into the interstitial space, causing swelling edema. 3. Leukocyte recruitment and activation. Leukocyte recruitment: neutrophils and other leukocytes migrate to the site of inflammation through 2 primary mechanisms. Rolling adhesion: leukocytes transiently interact with the vascular endothelium and roll along the vessel wall. 3. Leukocyte recruitment and activation. Firm adhesion: leukocytes firmly adhere to the endothelium and then migrate across the vessel wall into the interstitial space. Rolling adhesion: leukocytes transiently interact with the vascular endothelium and roll along the vessel wall. 3. Leukocyte recruitment and activation. Firm adhesion: leukocytes firmly adhere to the endothelium and then migrate across the vessel wall into the interstitial space. 3. Leukocyte recruitment and activation. Leukocyte activation: upon reaching the site of inflammation, leukocytes are activated by chemical mediators and other stimulating factors, releasing enzymes, cytotoxic substances, and cytokines, contributing to pathogen destruction and debris clearance. 3. Leukocyte recruitment and activation. Rolling adhesion: leukocytes transiently interact with the vascular endothelium and roll along the vessel wall. Firm adhesion: leukocytes firmly adhere to the endothelium and then migrate across the vessel wall into the interstitial space. 4. Role of cytokines in inflammation. Pro-inflammatory cytokines TNF-alpha, IL-1 beta, and IL-6 are key pro-inflammatory cytokines that initiate inflammatory responses, amplify the production of other mediators, and promote leukocyte recruitment and activation. 4. Role of cytokines in inflammation. Anti-inflammatory cytokines IL-4, IL-10, and IL-13 are anti-inflammatory cytokines that suppress inflammatory responses, reduce the production of mediators, and promote tissue repair. 5. Regulation of inflammation. The intricate regulation of inflammation involves a delicate balance between pro-inflammatory and anti-inflammatory cytokines. Other factors also play crucial roles in modulating inflammation, including 5. Regulation of inflammation. Immune system. Immune cells, such as lymphocytes and macrophages, participate in pathogen recognition and elimination while also releasing cytokines that regulate inflammatory responses. 5. Regulation of inflammation. Coagulation system. The coagulation system contributes to controlling tissue damage, preventing bleeding, and facilitating tissue repair. Complement system. The complement system participates in pathogen destruction, activation of immune cells, and modulation of inflammatory responses. 6. Outcomes of acute inflammation. Acute inflammation can lead to various outcomes depending on the severity, cause, and the body's ability to respond. Resolution. After pathogens are eliminated, the injured tissue is repaired, and normal function is restored. 6. Outcomes of acute inflammation. Scar formation. If tissue damage is extensive, the body may form scar tissue to repair the injury. Chronic inflammation. If the pathogens are not eliminated or the body cannot control inflammation, acute inflammation can transition into chronic inflammation. 6 Outcomes of acute inflammation. Acute inflammation is an essential protective response to combat infection and tissue injury. However, if left unchecked, it can have detrimental consequences. Understanding the mechanisms of acute inflammation enables scientists and clinicians to develop effective therapies to control inflammation and promote recovery. Disclaimer: the information provided here is for general knowledge and informational purposes only, and does not constitute medical advice. Always consult with a qualified healthcare professional for any health concerns or before making any decisions related to your health or treatment.